And I check for any signs of spinal pain. And I usually start with the neck. I brace my hand here, and I'm going to move him slowly all the way to the side. And a normal dog should be able to touch his nose to his side. And I'm going to check both sides and make sure that there isn't any evidence of pain. And then I want to extend the neck up, so I brace the neck a little bit here and point his nose all the way up. For flexion, I want to flex the high cervical area, then I want to check lower down. So I flex him like this so the nose is pointing straight down. And then I'm going to flex him like this so the entire neck is going down. Then I want to check for any pain along his back. And I start where I left off, at the lower part of the neck. And I palpate down each spine, and normally you'll get a little bit of a give in the spine. And then I note for any tenseness, any pain, any reaction, any tense musculature, and then symmetry of the hips. Next, I want to check his cutaneous trunci reflex, and it ends about L4, so L4-5 area. So I want to start there, and I'll just pinch on each side and make sure it's symmetrical and appropriate. If I don't get a response, I'll move up a little bit and see where the cutoff is, especially in animals with spinal cord disease. And I make a note if it's abnormal on one side and normal on the other side. Next, I want to check the perineal response and do a rectal exam. Okay. I also want to check for any lower back pain or tail pain, and I flex the tail up and to each side and see if there's any response. For the perineal response, I want to just stroke with my hemostat. I'm looking for a little pucker. Sometimes the tail will move as well. And then I'll finish up by doing a rectal exam, looking for any masses internally, any big lymph nodes, and of course checking the rectal tone.